Hello there.
Hello.
My name's Gavin Britton. I'm one of the medical doctors.
Hi.
Is it Mrs. Boss?
It is, yeah.
Your GP's written to us and asked us to have a chat with you about your headaches, if that's all right.
Yeah, that's fine.
Can you tell me a bit more about them?
I've had headaches now for about 6 years and they're gradually getting worse.
Okay, so they started about 6 years ago.
Yeah.
And prior to that, were you the type of person that normally gets headaches?
No, not really.
And can you describe the headache at all for me?
They started off just being like short headaches and now they can be long, it can be daytime, nighttime, crushing pains.
Okay. And are they on one side of the head or both?
Yeah, always left side.
Always the left side, okay. And you mentioned they can be at daytime or nighttime. And do they tend to last the whole day or just a short duration?
They can last all day, they can last a few minutes, a few hours.
Okay. So
There's no
varies,
pattern.
Fine, okay. And do you ever get any aversion to bright lights or loud noises?
No.
No. And are there any changes with stiffness of the neck, for instance?
Sometimes I get pains in my neck.
Okay, fine. And have you noticed, and your GP's mentioned that you've noticed some changes with your vision as well. Can you tell me a bit more about that?
Just the reading side of things, close-up work.
Okay. You've not noticed any other changes,
No.
such as pain in your eye at all?
Only when I've got the headaches.
Just when you've got the headaches. And does anything make that headache worse or better?
No.
No. And is the visual problems associated with the headaches? Or?
No, my reading is any time.
Okay.
Yeah, but the pain in my eye is when the headaches are there.
Okay. And do you ever get any redness or grittiness of the
No.
eyes? Do you ever find yourself bumping into things, for example, or not being able to see properly?
Sometimes, but I rush around a lot.
Okay. So
But not through not seeing, just bumping into things.
Okay, fine. Is there anything else you've noticed?
My face has changed. My family have said they've noticed a difference in my face.
Okay.
I've got a lisp now, which I didn't have before. And I've got a lot of bone pain.
Okay.
So.
You wouldn't have any pictures of yourself from
Yeah,
previous, would
brought
you?
some in because they said how I've changed.
Okay, that's quite helpful. And have family members commented on how else you've changed? They've mentioned the lisp.
My nose has got bigger. I
Okay.
seem to be frowning a lot. My eyes seem to be closing more.
Okay.
And my lips got bigger.
Okay. Has there been any changes with hands or feet?
Yeah, I've had to have my rings cut off because my hands are swelled up.
Okay. And your feet, have they changed at all?
They've gone up 3 sizes.
Fine, so they've increased in size as well?
Yeah.
Fine. Okay. Any weakness in arms or legs, or pins and needles in any of your arms or legs?
In my hands, especially when they're really swollen.
Okay, you get pins and needles?
Yeah, numbness.
Numbness, okay, when they're quite swollen?
Yeah.
Fine, okay. I'm just going to ask you some other questions now, just to look for anything else that might be happening as well. Do you have any coughs or colds?
No.
Or any shortness of breath?
No.
Any chest pains or palpitations?
No.
Any problems when going to the toilet, such as diarrhea or constipation?
No.
Any pain on urinating or going to urinate more often or less often?
No.
Any problems with the skin, such as rashes, itchiness, or ulcers?
No.
Any changes with your weight at all?
It varies up and down, but just like normal.
Fine, okay, so no weight loss that you've noticed?
No.
Any night sweats or fevers that you've noticed?
Yeah, I get hot flushes.
You get hot flushes, but... Okay.
But I'm at that age.
Okay, fine, okay. And can I ask, do you have any medical problems that have been diagnosed or you see a doctor or a nurse for?
Just hay fever.
Just hay fever. And do you take any medications at the minute?
Just allergy tablets.
Fine. And are you allergic to any medications?
No.
Okay. I'm just going to have a look at you now, if that's all right. Okay, I'm just going to have a look at you from the side as well, if that's okay. Okay. And if I can just ask you to pop your mouth open for me and stick out your tongue. That's fine. And if you grit your teeth for me. That's okay. I'm just going to have a look at your hands now as well. Could I ask you a little bit more about your home life, if that's all right?
Yeah.
Who do you live with?
I live with my husband and my 3 children.
Okay. And do you work at the minute?
Yeah, I'm a senior carer.
Okay. And does this affect your work at all?
I just get really tired and painful joints.
Okay.
And when I work through my headaches. So.
Fine. Okay.
Yeah.
And can I ask, I'll just take that off here. Can I ask, do you smoke at all?
No.
Have you ever smoked?
No.
And do you drink any alcohol?
1 a week, 1 glass a week.
Okay. And do you take anything over the counter?
Just paracetamol.
Just paracetamol?
Yeah.
Do you take any medications or drugs that aren't prescribed?
No.
And do you have any allergies?
Not to medication,
Okay.
no.
And are there any medical problems that seem to run in the family?
No.
Okay. Okay, what I'd like to do now is if you can cover one eye for me, and if you can look directly into my eye, I'd like to say yes when you can see the red pin.
Yes. 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 Yes.
Okay, I'm just going to swap hands. You keep looking into my eye.
Yes. 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 Yes.
And if you swap eyes for me.
Yes. 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 Yes.
That's okay.
Yes. 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 Yes.
2 minutes remaining.
What I'd like to do now is just test how your eyes move. So if you can keep your head looking forwards, but follow my finger with your eyes if that's all right. Let me know if you get any double vision.
Okay, having taken the history today, what is your diagnosis?
So this middle-aged lady presented with headaches, a change in facial appearance, increase in hand and foot size. On examination, she had sweaty palms with increase in soft tissue swelling in the hands and face. She had an overbite of the lower jaw and splaying of the teeth. My diagnosis based on this history and examination is that of acromegaly.
So what investigations would you now perform?
So I'd like to do a baseline IGF-1 and I'd expect this to be raised. I'd then proceed to do a glucose tolerance test and I'd expect a failure of suppression of growth hormone. And I'd then go on to do an MRI scan looking at the pituitary.
Okay. What other organs can be affected by acromegaly?
There's several organs that can be affected by acromegaly. Patients can have complications ranging from type 2 diabetes, hypertension, cardiovascular disease, carries a substantial increased risk, including ischemic heart disease and cardiomyopathy. There is also the risk of bitemporal hemianopia, which obviously can have significant social impacts on patients.
Just explain the bitemporal hemianopia to me. What's the mechanism?
So bitemporal hemianopia occurs due to compression of the optic chiasm.
Okay, excellent. What are the treatment options available to such patients?
So the mainstay of treatment is via surgery, so via transsphenoidal resection, which aims at being curative. Second line treatments are medical treatments such as dopamine agonists such as bromocriptine and somatostatin analogues such as octreotide. Third line treatments include radiotherapy to the pituitary.
Okay, let's concentrate on surgical intervention for a moment. What are the potential complications of surgical intervention?
The main complication to warn patients of is that of hypopituitarism.
Okay, excellent. Well done. Thank you.
Thank you.